as possible deficiency of oxygen on the cornea. And adding other reason why the corneal lenses have damaged, in fact, the cornea, is that also in normal human people wearing contact lenses only because myope, hyperopic or whatsoever, the count of the contact lenses will diminish much more than the normal diminishing by aging. So imagine if this is on normal people, how much worse is on a keratoconus patient. Then we have another problem. We have the scratching of the lens over the cornea. What we call leucoma in a keratoconus is 99% of the cases the consequence of an abuse, a wrong use, misuse, or in any way too much use of a contact lens. 90% hard contact lenses. Who has a leucoma can raise the hand? I know some of you, not all of you, but I'm sure that the leucoma will be in this part of the eye. Up, down. It means in the central lower part of the eye. Correct or not? Can you correct me? Io sono sicuro che il leucoma sta nella parte media inferiore dell'occhio.
Parte inferiore dell'occhio.
Medio, centro inferiore.
Jeder Leukom befindet sich so südlich.
Now we have the last reason why contact lenses damage the keratoconus. The parasite, the unknown parasite, unfortunately is a particular kind of parasite that loves very much a place where is lacking of oxygen. So when you wear contact lenses, it will thank you. It will say, thank you very much, we can grow faster and stronger into the cornea, the parasite. Okay, we finish with the contact lenses. But still the contact lenses, if they are properly applied, and believe me, very few can properly apply. So you must take in consideration the very few that know how to apply correctly a contact lens. Mostly, if the contact lens is a soft lens, will help you in your stage of keratoconus 2, 3 to see. So unless you not decide for a surgical procedure, you cannot choose other than a contact lens to see. But it doesn't mean that it's something that is helping your health. That must be very clear in your head. It's a necessity, it's not something to choose because better of other things. Anyway, so we finish with the contact lenses. I think for the genetic, if you have something you have not understood, better you ask me now that we finish also with the genetic and we go on with the comparison of the different treatment for the keratoconus.
Did you find any cases of your infections? Do you find a virus or a bacteria or something?
It's a parasite.
What is it?
Parasite.
Did you identify this parasite?
We think we have identified it. Now, going on to the comparison of the different solutions for the keratoconus. You have the cornea transplant, that is the classic solution that, as Professor Yorko Mike in Barcelona 2 years ago has said, must not be considered anymore the elective solution for the keratoconus for the keratoconus sickness. And I agreed immediately, and I was fascinated by the relation that Professor Krumaj took in Barcelona. He told about his last 10 years operations, and he saw that in the last 10 years the survival of the cornea transplant was no longer than 5-6 years. So if one of you should make a cornea transplant, should be very old, because if only 6 year average to wait cannot be the right solution. Obviously, the new studies and new attempt to make lamellar keratoplasty is much more logic than the old total corneal transplant. But you have to know also one thing, that when you go for a lamellar transplant, excuse me. When you go for a lamellar transplant, any doctor in any clinic of the world will make you sign an agreement. It is called informed consent, in which you take the responsibility that in case something goes wrong during the surgery, the surgeon can change while you're sleeping for the transplant, can change from a lamellar transplant to a total transplant. Is it right? Is it right? So you see, the 90% of the lamellar transplant today in Italy are in fact, they become in fact total grafts. But still, the lamellar keratoplasty is much, much better than any kind of total graft. Then we have another surgery, that is the epikeratoprothesis. Epikeratoprothesis is the oldest and I think the most logic today surgery, invented by Professor Kaufman in Louisiana, New Orleans University, and is done with a donor tissue where is being removed the endothelium and will be implanted on the cornea, stitched all around like in a normal corneal transplant. This to make it simple. In fact, this system is working effectively, but we don't know why, or better, I imagine why. At a certain moment, years ago, the American industry, I don't remember it was Alcon who was, that imported the lenticles for the epikeratoprothesis, stopped doing that. I know that Professor Krumaj should do with fresh lamella. And the solution is also with the fresh tissue. But the tissue normally was dehydrated and stocked, frozen, and then rehydrated and implanted on the eye. This has a sense because it will increase the thickness of the cornea, will cover with a large patch the eye, and normally you can only lose from 1 to 2 lines of the vision. Now, myself has implanted several of these lenticles when they were available, but we had 2 severe cases of inflammation and possible infection. We had to remove the lenticle very, very fast, and I think that one eye has suffered severe injuries from the procedure. But in any case, the other patients were well, happy, satisfied. They could not see 100%, but the cornea didn't move anymore. But at a certain moment, this industry sent us a letter telling this lenticle will not be supplied anymore after this date, without giving explanation. I know that there are some legal bargain in USA for possible infection through HIV virus through the lenticles, and maybe this can be a reason why the market has stopped giving this beautiful solution for severe and half severe keratoconus. The other solution is the laser. In Italy, our president of the Ophthalmic Society today is proposing the laser, excimer laser, on the apex of the conus, and is also writing scientific articles in which he declares that the laser treatment will stop keratoconus growth.